start to do restorative things for myself from an exercise point of view to keep the body moving. Motion is lotion. So we want to keep the body moving and help to lubricate those joints, keep the blood flowing to the muscles, and overall improve our flexibility and even as a result, our longevity.
Welcome to the Lara Jane Layton Show. This podcast is for you, the person who keeps putting others first. Your self-talk has held you back. You no longer need to take a second seat. Let's explore ways to overcome self-doubt. You can silence that inner bully voice and achieve your full potential. Here's your host, Lara Jane.
Welcome to the show, friend. I have a new best friend, Stacey, with me. I'm so excited. I love it when we get to talk about health and wellness and making our bodies really just be the best they can be. And I know for me lately, movement. I need to be able to move without pain. I'm so tired of not going up and down the stairs because it hurts. It's not that I can't do it. I just don't like it. So Stacey is really good at pain management. And we're going to just talk about as we age, how our bodies change and what we can do about it to feel young and youthful and have that energy that kind of disappeared a little time ago. But before we get started, we're going to get a quick word from our sponsor. When we come back, Stacey, help me get rid of all these cricks in my body. We'll be right back.
This is Adam Adams, co-founder of Optimized LLC, where we take the guesswork out of your health. If you're feeling exhausted, struggling with weight, or just not feeling yourself anymore, your hormones might be the problem. And that's why we test, not guess. Analyzing your blood work to pinpoint exactly what's holding you back. At Optimized LLC, we help you rebalance your hormones, boost energy, and reclaim your life. Don't settle for normal. Aim for optimized. Just go to optimized.com to book your free introductory coaching call. It's a free call to help you take the first step toward feeling your best.
All right, Stacey, the information about you is in the show notes. Let's get this going. Where does this pain come from in the first place?
That's a great question, Laura Jane. And I just want to say thank you so much for having me on the show today. I really appreciate the opportunity to spread the word about how, women and even men can help to optimize their body so that they aren't experiencing that pain later in life and can be as active as possible. So really, as our hormones change, what a lot of people don't realize is, if you're out there feeling this type of pain that just comes up out of nowhere, many times it's happening because your estrogen and progesterone levels are decreasing through perimenopause and menopause. And what people don't realize, when those hormones are in their sweet spot, they are actually anti-inflammatory for our body. So there's some anti-inflammatory activity that those hormones can provide to our body. So if estrogen's too high, it can be more pro-inflammatory. If it's too low, we lose that protective effect for both estrogen and progesterone. So that's why these things kind of pop up out of nowhere. And stress, unfortunately, in our age category can sometimes exacerbate that too.
Well, we work long and hard hours. It can't be stressful. Balancing everything I have on my plate and need to do can't be stressful.
Right. And then you've got teenagers in the house while we're going through menopause or perimenopause. And, so we're pulled in so many different directions. So stress definitely plays a role.
I notice that sometimes I surprise myself. When I show up or I respond out of emotion, I'm different than I used to be. Not as gentle, more like I'm just tired of this, just get out of my face. And so, part of it is just that exhaustion and it is from the aging and the changing in hormones. Is it fixable?
Absolutely. So it's that fuse that gets a little shorter and shorter, and we become a little bit more irritable. We also, as we age, figure out what's important to us too. So we're not, at least your listener hopefully is not as much of that people-pleasing person that they, used to be, because they realize that that's not where they want to be in life, right? So it absolutely is fixable when we can look at different lifestyle interventions. There's different modalities out there. There's some simple tips that we can talk about to help to manage stress that we have under our control every single day.
I can control it. Teach me.
Absolutely. So one of the very first things that we can do to optimize, that hormone fluctuation and keep it from being a big deal. And again, very simple is just even looking at our breath. So there's something called diaphragmatic breathing. Diaphragmatic breathing is where we're getting more of the breath through our diaphragm and less through our accessory muscles, which are in our shoulders, that type of thing. And if we do diaphragmatic breathing, that's been shown to upregulate what's called the parasympathetic nervous system. So that's the part of the nervous system that when we're, clued into that part, connected to that part, is more of rest and digest. It's restoration. So we're not constantly giving, and depleting. We're actually putting back in, putting more deposit into our, body bank, basically, with that type of breathing. And then there's other things that take a bit more effort, like looking at our overall eating plan, lifestyle, what we're putting in our body. When we lose that protective effect from estrogen, progesterone, our body is less tolerant to things that would previously we'd be able to tolerate, certain foods, alcohol consumption, those types of things. So, taking a look at that, our gut health as well. There's many different studies now showing all the relationship between the gut and the brain, but also there's a huge relationship between gut and joints and muscles as well too.
So where do I start? Like others, like, do I just start with, I don't know.
Yeah, I mean, just even starting with that diaphragmatic breathing is probably the easiest thing to start with to help to optimize and overall control our stress. So when our cortisol levels, which are, helps to address stress in our body, when those rise a little bit too much, what can happen is it can deplete our progesterone levels even further and faster. So then if we can get into those diaphragmatic breathing states, whether that's through prayer or visualization or meditation, or even just sitting, at a stoplight, taking some big deep breaths through our diaphragm. That's an easy place to start to help to regulate our cortisol levels. And then sitting back and really, looking at ourselves in the mirror and saying, okay, what do I need to change? Where am I being depleted in my life that I can, stop that, plug that hole and start to do restorative things for myself from an exercise point of view to keep the body moving. Motion is lotion. So we want to keep the body moving and help to lubricate those joints, keep the blood flowing to the muscles, and overall improve our, our flexibility and even as a result, our longevity.
How do I know if I'm breathing right?
So one of the easiest ways that you can do diaphragmatic breathing, the first way that I teach it my patients is first they're lying on their back and they put their hands on top of their belly. And when they take a deep breath, if their belly doesn't rise, but their, chest rises and kind of the neck gets tight, then I know most of the breathing's coming from those accessory muscles. And those accessory muscles are less efficient. But if I can take a breath and my stomach rises, that I know that my diaphragm is filling with air and we should have less activity or even no activity in those accessory muscles. Then as you kind of feel that feeling from a lying down position, that's where you can sit up and do it, be standing and do it, and you can really do it anywhere you are in your everyday life. So that's one way that you can kind of take yourself and become present in the moment. We all know and have heard of mindfulness, but that helps us also become present in the moment so we can breathe, right? And help to regulate our stress levels by doing that.
People always say, just breathe. And it's like, I am. But
Mhm.
it's like, just do some conscious breaths.
Right. Exactly.
Like where you're paying attention to it.
Mhm.
Whether it's, do I feel it in my nose or do I feel it in my chest or my diaphragm? Where, it's trying to analyze that breath. It's paying attention to it, which brings you into the present all of a sudden. It's amazing how fast it can work.
Absolutely.
So now I'm learning to breathe deep with my diaphragm. And I think I have this natural, it's a cleansing breath. It just happens. And like that deep breath and that sigh. And it always feels so good. Is there more kinds of breaths that I can do that would support that reduction of pain or balancing my hormones or relaxing? Is there more, or is that just the one that works?
No, absolutely. There's several different types of breath work that you can do. I mean, there's even breath work courses out there for people to take, breath work groups that people can look in their local community to find. All of those things can help. There's one that I recently learned. It's called the pineal body, breath work, which the pineal body sits kind of in the bottom and the center of the brain. And you can draw up your breath all the way down from your pelvic floor, up through your spine, up through your heart, up to the top of the brain. And they're doing in Dr. Joe Dispenza's workshops and his meditation retreats, they're doing research to show that these types of meditation techniques actually improve your physiology. So they're taking blood samples, saliva samples, microbiome samples through fecal matter and even urine samples. And what they're finding is the body's able to create its own opiates, right? Its own morphine, its ability to endorphins, to really create our own anti-inflammatory molecules to be able to release and decrease pain and even eliminate it.
Would I be able to breathe a headache away?
Absolutely. I utilize this used to get migraines all the time and then did a lot of work on my gut health. And I haven't had migraine in 10 years, except for when I came back from this retreat. I was pretty depleted because, I was meditating like 5.5 hours a day and still trying to manage my business in between sessions. And, my cortisol levels were really challenged. And I got a migraine, which I hadn't in, said, about 10 years. And I was in bed, lying in bed and just doing that same breathing technique where I'm drawing that kind of that energy up through those areas that I talked about. Some people call them chakras or energy centers, or you can just, name them from the physical parts of the body that they are. And absolutely, it settled down the migraine, settled down my pain overall. So I was much more comfortable as my body kind of recovered from that overextension of use.
As a younger person, I got migraines all the time to the point where light sensitivity was my first clue. Recently, I was re-diagnosed with migraines that I didn't have any light sensitivity. I was like, oh, this is a migraine. I didn't know.
Mm,
So, but there's, maybe 15-year span between when I didn't have them. I was like, oh, so there are different symptoms with migraines that I didn't know that. So I could breathe those away without taking these nasty tasting pills and having that after medication blah.
absolutely. And you don't usually have an after meditation blah when you're doing it right, and you have an after meditation, energy, right? So it's
I
more
meant
really refreshed.
medication blahs. You
Oh,
know
got
how
it. Yep, I
I
gotcha.
pronounced it wrong.
I gotcha. No, but yeah, absolutely. You can feel more rejuvenated after utilizing those. And I'm not going to say that it's going to work as fast as maybe a medication, but the problem with those medications is if you take them continuously or even preemptively to try to knock out those migraines or any muscle or joint pain, the research actually shows that you're increasing your risk of developing chronic pain or what's called pain hypersensitivity. That means that when they wear off, the pain actually hurts worse than it would have if you hadn't taken it at all. So don't realize what the taking those medications long term can do. We're so conditioned to take them quick, at the first sight of pain or even to prevent it, without really thinking about the long term impact that it's having on our immune system and our overall health.
My thought on pain medication, I take it, even though I have these thoughts, but it's just masking the symptom.
Hmm.
It's only taking away the pain portion, not what caused it, not how it got there in the first place. And so really if we can step back far enough and go, where it does migraines or other muscle pain or joint aches come from? I thought I had arthritis. It's not arthritis, it just hurts.
Yep, my friend Jack Canfield, who Chicken Soup or the co-author for the Chicken Soup for the Soul, he talked about it as it's like taking the batteries out of your smoke detector. So, the fire's still there. You just won't have the warning signs that it's there and how much damage it can do. So it kind of blunts our response to that pain. And by not addressing that underlying cause, we're still kind of wearing down our system without really, having any without paying attention to it, and that eventually creeps up on us and bites us in the what.
I've always looked at pain as the check engine light on of my car. It's like something is going on in your body. It's not, hey, get rid of the pain. It's, hey, look deeper. What's in there? I've had a lot of things doctors can't find, and you just go, okay, I'll live with it. Um, are there solutions with hormones or something that could help people that are in that state of we can't find what's wrong with you?
Absolutely. So you mentioned very astutely that pain is really a message, right? So when I talk about the pain free formula program, it's not about never ever having pain again. I actually want you to feel pain because it protects you, right? So if you're moving towards, a fire or, an area that where you can get hurt and you feel pain and that keeps you from getting hurt, that's a great way to protect you. But when pain becomes something where it's interfering with your life, then absolutely that's something that can be addressed. And what I do at my clinic is that we just meet each person where they're at. So some people might need to look at their biomechanics, how they're moving, right? Other people might need to look at what could be impacting their hormone levels. Like, for example, people think, well, I'm menopause, I'm just going to have hot flashes, I'm just going to have, muscle and joint pain, which a lot of people don't know is just as or more common than hot flashes. And really what we should kind of switch the framework to be, okay, what can I do to prevent these things from coming on instead of going, oh, it's just my lot in life that I'm going to have to deal with that. And by looking at our eating plan, many times we can decrease that inflammation that we're creating in our body by the foods that we're eating, because we won't be able to tolerate those foods as well going forward because that we have less of that hormone protection with less of that estrogen progesterone. So changing our eating plan, adjusting our, alcohol use, maybe decreasing or in some cases eliminating it, watching our caffeine consumption to be minimal, minimizing sugar. But then there's the people that come to me and say, look, I do all that and I'm still experiencing pain. Then we look a little bit deeper, even into good foods that may be bad for you. We each can have food sensitivities, whether it's dairy, blueberries, white potato, whatever it is. That for me could be an issue. For you, totally fine. And we identify those things and start to remove them from our diet and work on optimizing our gut. Because also, what your listener might not know is that the gut helps to metabolize our hormones, right? So it helps us decide, it helps our body decide what hormones we're getting rid of and which ones we're going to recycle, right? So the gut is really extremely connected to our hormone balance. So we need to look at what we're putting in our body to also optimize our hormone balance.
If I've gotten so old, I have no estrogen left in my body, is there a way to reverse that aging or am I stuck with taking pills?
So you probably don't have no estrogen in your body. Most women, if they are in menopause, are still producing estrogen from their ovary, or it's not their ovary, sorry, their adrenal glands. So once their ovaries kind of take a hiatus or they're taken out for whatever reason, our adrenals are still producing estrogen and progesterone. So we can maximize the production of that. We're not trying to do it for fertility purposes. So we're not trying to bring on a menstrual cycle again, but we can optimize those levels for where we are in life, and that can be done naturally. Again, food, gut health, there's herbs that can help support that 100%. And then some people will take the route of the hormone replacement. If you do hormone replacement prior to doing all the things with your eating plan and working on your gut health, you will likely feel pretty good for the first, month or two or three that you're taking the hormone replacement, but you're still not addressing the underlying cause, right, of that other inflammation. So then symptoms will start to creep back in. You'll think you need more hormone or you're not on enough or you're on too much. Instead, you might need to, again, go back to the basics first and take do those things first. And then when you knock out, 75% of your symptoms, if the pain is still hanging around, hormones might be great for helping you get rid of that at the end. So everybody, again, has their own opinion on what they want to do. So I help support people in the direction that they want: natural, hormone replacement, or even a combination of both.
How do we know if we need more or not? Is it
More.
only a test? Hormones.
Well, you look at your symptomology and what you've been experiencing once you're going through this phase of life. And if that's improving, then you know that you're on the right track. But there are tests to quantify things as well too. Some people just do blood tests, but a test that I like to do is a urinary metabolite test, because that gives us the different levels of hormones, including cortisol, DHEA. Some people have heard of it as the Dutch test as well. Looks at estrogen and progesterone and testosterone, but it also looks at the metabolites. And what metabolites tell us is how our body's utilizing those hormones, they're getting rid of, what we're recycling. And sometimes that's a lot more eye opening than just looking at the level of those hormones. because we look at level of hormones and they're all low, and then all of a sudden we take hormone replacement for all these hormones. The hormones react to each other, right? So if we're taking estrogen, progesterone, testosterone all at once, testosterone actually creates our estrogen. So we might need to only take, a little bit of testosterone to improve our estrogen levels, or even DHEA is another hormone that creates testosterone. So, and like I said earlier, progesterone influences cortisol production. So we really need to be careful if we're, adding in hormones, because it's not like taking a vitamin supplement. It's more bioactive to add and kind of play with the hormones. So you can do it by symptomology and in combination with what you see in test results. And my preference is urinary metabolites and blood tests, looking at both of those. And some people look at saliva tests as well too.
Okay. And I'll have to look into more of this because I know maybe it was 2 years ago I had turned into a raging bitch. I mean, everything was irritating me. I just couldn't take, I just go away, go away, go away. And uh, low dose of estrogen has taken that away. I feel like I can at least choose my response instead of just like losing it.
Yeah. And gratefully, the studies are showing that, low dose of estrogen, progesterone, and the hormones can be beneficial for sure going to in the long term. And if you were my patient, Lord Jane, I would sit down with you and go, okay, so why were your estrogen levels so low that you were feeling like you wanted to break somebody's neck, right? So then we would also work on
Not
those
just somebody's, everybody's.
everybody's. So then we would look at why that was happening and what other areas in your life you wanted to work on, whether that was energy, whether it was weight, whether it's sleep, whether it's skin. All those types of things will also be a part of and then be incorporated into what your hormones are doing as well too. So there's obviously it helps those couple of symptoms, but if we want to look at ourselves holistically, there's so many things that are related to overall gut health and inflammation. And we tend to segment our body, right? We tend to segment it into these little pieces, like skin is separate from gut, is separate from hormones, is separate from this, but it's really all together. I mean, we could really state our case that, the gut is really the center of all those things. And if we optimize that, it's going to have, several branches being able to help us optimize everything else in our system.
So is most of what I need to deal with is making sure my gut is healthy.
That would be a really large focus if you're looking from a holistic point of view to manage a lot of different symptoms that seem like they're, 10 separate things when they really could be one area that we really want to look at. And by managing our gut health, we're looking at some supplements, but really, again, going back to what we're putting in our body, as that's where the food for the gut really comes from primarily.
Are there certain foods that would affect everybody the same, or does it really depend on each individual and the way they process food? Like you could say, nobody ever should eat a green pepper,
Mhm.
but everybody's different. So that couldn't be. But is there one that is like that? I just made up a food.
Yeah. So, if you're looking at whole foods like green peppers or whatever, they are going to be generally good for whole foods are generally good for everybody, but within that subset, there'll be people that don't tolerate certain foods. Could be from a genetic predisposition, or some people, don't like the taste of cilantro, for example. There's a gene that kind of regulates that. So, but the foods that everyone should stay away from and are really hard to stay away from because they're cheap, and they're all over the place, are the ultra processed foods that really aren't food anymore. They're so processed, it's just a bunch of chemicals put together into something to make it taste good for us. So those are the foods that really everybody should stay away from, just general blanket. And then the good foods we know that we should have that are closer to your whole foods or whole foods, for example, then some of those can sometimes be an issue for some people. And you and I could, you could eat white potato and have absolutely no reaction. I might have white potato for a couple days and then I get eczema. or I might, feel really fatigued or really tired or have joint pain as a result. And I'm just using white potato as one example. It could be really any food. So that's where food sensitivity testing, I use the ALCAT because IgG testing has been shown to not be really accurate for food sensitivity. So the ALCAT is something I've used for 15 or 20 years with patients to help determine what their specific situation is. And that's really personalized medicine. And that's where you can really go a long way to improving your situation if you're looking at what your body's doing and not just comparing it to, a million other people.
I took a food sensitivity test. I have no idea what it was, the name or what kind it was, but long, long time ago. And I remember just looking at it and going, this is so wrong.
Mhm.
you know, Things that were on the list that I had no sensitivity to, like walnuts, make my mouth swell up. And, I was like, this thing, I don't even know where they got their, maybe they got somebody else's blood. I don't
Mhm.
know. But I just remember thinking, this is not right. But it could have been what I took.
Yeah.
So would I ask for would you call it the L stat?
ALCAT. So A as in
Cat.
apple. Yeah. L as in Larry, and CAT as in cat. So ALCAT. So that one has some Yale research behind it. It has been around for a long time and a lot of good research, especially related to IBS symptoms. So that's the one that I utilize. Another one's called MTR. So M as in Mary, T as in Tom, R as in Robert. That's another really good test. That one has to go specifically through a physician. The same person who invented the LCAT kind of adjusted it and then created the MTR test. But the other tests that are really not as accurate as we used to think they are called IgG tests. So if you look and see if the test is an IgG test, they're less efficient or less accurate for foods that we're sensitive to.
That's probably what I took.
Mm, sounds
I
like
have
it.
no idea, but I just know it was like, this is so wrong.
Mhm.
So, what, I- and I know it's my fault. We're jumping all over the place, but there's so much information that I just don't know anything about. And so it's like just trying to gather a little bit at a time. But when we just dial right back to hormones, that's not just testosterone. And there's so many other hormones that you mentioned, cortisol and stuff. How, is there something out there that can just look at all of them at once, or is it like a million different tests to look at them all?
Well, there's so many different hormones. So I remember when used to live in Australia, I was there for about 14 years, and I remember I was so excited when I'm like, okay, I got this hormone. I understand the hormone cascade. I really can see how they affect one another, and I can help people with it. I went to a physician friend of mine office, and she had all the biochemical reactions of all the different hormones and all these different substances in the body all over one wall. And the hormones that I thought I knew so much about was like 1/1000th of that whole wall. And I'm like,
Oh no.
"Oh, I thought I had this all down," right? But what I can say is that there are those tests that I talked about, the urinary metabolite tests, to see how your body is utilizing those hormones. And if we can utilize those together with blood tests, and then some people also use saliva tests, that would be the ultimate. It can get pricey, right? So we don't necessarily need all those, but usually blood tests can be covered through insurance if you can get your doctor to do certain testing. And for women who are still menstruating, there are better times during the cycle to do some of these tests, like the day 2 or day 3 of the period, or 7 days after ovulation, can give us a good idea of the balance between estrogen and progesterone in the latter half of the cycle and how our estrogen levels are doing in the beginning part of the cycle. For women who are transferring or transitioning into menopause, those blood tests are going to be a little bit less accurate because the cycles can be all over the place, but still gives us some baseline. And then that's where the urinary metabolites can come in because they look at cortisol, DHA, progesterone, estrogen, testosterone, and how our body's utilizing them. So I like to use both of them together, one covered by insurance, one paid out of pocket, so people can get a good idea, a good overview of what their body's doing.
So, as for our friend that's listening here with us, her first step should be call you.
Well, I think so.
It's like, let's play that angle. I'm going to call you, Stacey, and I want an appointment. how do I need to be prepared for that so that we make the most of our 10, 15, 20-minute get to know each other? Are we going to work together call?
Yep. So see people in there that we see for 60 minutes for an hour, and we sit down and we talk about anything that they've done in the past. So if you have blood tests or urinary tests or anything like that that you've done in the last 6 to 12 months, I'd love to see those. If you don't, that's okay, because we'll look at the comprehensive health questionnaire that you filled out, and we'll figure out which tests you should be doing at this point in time, or that would be valuable for you to do, that we can look at together. Then once those come in, and then we'll talk about maybe what supplements you're taking right now. Most of the time I'm taking supplements away versus adding them in, because most people are coming in with like a bucket full of supplements. And then I'm looking at the ones that they absolutely need. And we continue to tweak those over the time that you see me. So we get that plan together in that first meeting. And then I might see you 4 to 6 weeks after that to review some updated blood tests or the urinary metabolite test that we did. And this is if you're seeing me for just optimizing hormones. If you were seeing me for pain reduction as well too, we in our office, if you are local, we have a device called Soft Wave, and it's a modality that helps decrease localized inflammation. And then I also do manual therapy on the body to help you move better and help the joints move more smoothly. And I look at your biomechanics, how you're walking. I can do that over telehealth too. I can give you some tips over telehealth when I ask you to do certain movements and stuff like that. So it really depends on what your goals are and coming to see me. You don't have to have any information. You can just fill out your information about yourself, not necessarily any blood tests, or you could have a bunch of blood tests or a bunch of previous tests that you've done in the last 12 months, and we can look at those together and see if there's anything that we need to tweak or any additional testing that needs to be done, so that we can continue to personalize the program for your specific physiology. And not just, one of the things that's a pet peeve of mine is if you go to a person and they give everybody the same thing. I'm like, well, how is that personalized? It's more medicalized. It's like saying, you have this problem from a functional medicine point of view. You have adrenal fatigue, so everybody should be on all these supplements for adrenal fatigue. Well, that might not be good for you, right? I want it to be very specific to how your body's presenting.
Yeah, I don't like the cookie cutter approach,
Exactly.
but it is very helpful in some places. But, when you really want to dig down deep, I I like to see the person who doesn't have to have the cookie cutter.
Mhm.
Like I can look beyond what it is. And we all have what's familiar to us, what worked for us, and that's what we want to share first. When I say all, most of us when I just read this book and it was so good you're going to love it. Well, my husband and I are the perfect example of opposites. The books I love, he thinks are stupid. The one, they're just opposite. And so it's really taught me that not everyone is like me and that you're still pretty cool if you're not.
Right. We're all individuals for sure, and we need things personalized to us to get the best bang for our buck.
Yeah. And just going through all this is like how there's this question like, what can I do right now? Is probably get a gut health something going. What does make my gut healthy? First
Something
thing about it. Go
Yeah.
ahead.
So something that people don't realize for gut health is exercise. So exercise actually improves the health of your gut and the diversity of your microbiome. So just getting out, doing some exercise, getting moving in some way that is okay for you is really important. We talked about breath. Now we know through the studies, through like places like Dr. Joe Dispenza's network and research company, that even certain types of breath and decreasing your stress can optimize the microbiome as well too. And then clearly taking supplements that maybe are probiotics or eating foods that are high in prebiotics, like fermented foods, stuff like that. So starting there with just, one thing that you can do per week, just trying to change that, you're going to notice a big change overall. And then going to a person who can help you tweak the rest of the way.
Okay. So the gut, when it's clear, how does that help the rest of me?
So the gut will never be clear. So the gut will always have good bacteria and bad bacteria. But what we want is a diverse gut. So if we look at a jungle, we don't want like one maple tree and 1,000 maple trees and that's it. We want all sorts of different types of, vegetation and different things and making that soil really great for things to grow in. That's how we need to think about our gut. So we're always going to have some, let's say bad actors. But even some of those probably do something good that we're going to find out, as the more that we study them. But we want a balance of good bacteria and bad bacteria. So we want the good bacteria to outweigh the bad bacteria so that we, again, can decrease our inflammation and metabolize our hormones and other molecules in our system to help give us better health. So we want to be diverse as possible. So we don't want to always eat the same exact thing every single day because that doesn't give us the diversity. So we want to change different vegetables and fruits and whole foods that we add to our system and get rid of those things that can damage our gut, those ultra processed foods, fried foods, boxed foods, things that really aren't even close to food anymore when we start to read the labels.
Yeah, and I am so skeptical on labels. When it says no refined sugar, I think, is corn syrup refined sugar or is corn, what is really in there?
Mhm. Right, and if you
Because
can't
they're
pronounce
so
it,
deceiving.
yeah, if you can't pronounce half the things that are on the label, then it's probably closer to chemical versus food.
Oh, so much to learn and so little time to do it.
Yeah,
But well, we got the rest of our lives, right?
exactly, exactly.
I think this has been good. I don't know if we've really touched a lot on how these things affect pain and our muscle soreness and our joint weakness. Or I just said those backwards.
Mhm. Mhm.
But where all that pain's coming from could be a lot of different things,
Mhm.
but we're suggesting gut health is probably the thing where we start.
Mhm. Yep.
Um,
Movement, if it's pain that is, from like you went out to play pickleball and you got injured and the injury's not getting any better, then, movement is key, finding out how you're moving. I'm a perfect example of, I hurt my knee trying to do the polka with my son at a wedding. My knee popped and I ended up, spraining a ligament and causing some other inflammation and damage in there. And as a physical therapist, I was able to take care of it. But what I didn't realize is how my gait changed even slightly by doing it. And therefore, I developed plantar fasciitis down the road. I was like, what the heck is going on? And plus, I was going through my menopausal changes, and therefore, the less estrogen I had in my system, the more likely that those structures weren't able to heal as good as they could have. So I really just had to utilize my soft wave modality to decrease the inflammation, but change the way that I was walking, strengthen muscles, stretch muscles, and stabilize those joints as well too. So that if it's something that pops up out of nowhere, something I was sitting at the front desk with my office manager, and all of a sudden, just on my computer, and all of a sudden, my shoulder just went big, huge crack in my shoulder and kind of
oh
dropped.
no.
Like, what? And my office manager said, "What? What the heck was that?" I'm like, "I don't know." Well, again, it was the hormonal changes. Even issues with inflammation in my shoulder, that type of stuff. Just kind of crept up on me, and that just made me step back and go, okay, what do I need to pay attention to? The stress that I'm dealing with, my gut health, my eating plan, all those types of things, and letting pain be my guide. And then that told me that I need to look at my hormones a little bit closer than I was before to try to optimize those. So I think one thing is you can start working with your eating plan to try to improve your gut health, but you really need to get to somebody who understands kind of the holistic view of your body in order to be able to put the best program together for you. Because it would be like for me trying to fix my car without going to a mechanic. I mean, I kind of know what a muffler is and maybe kind of understand what a carburetor is. And I can probably learn how to change the oil in my car from a YouTube video, but I couldn't really optimize how my engine is running because I don't really know all the ins and outs about it. And somebody's taken years of their life to do that. So that's a lot of time why we need coaches who have been concentrating on these different areas to help over time.
Getting an expert involved always shortens my timeline.
Mm, yep.
Like I can figure it out, but if I can get someone else to help along that initial start, It gets things done so much faster.
Absolutely.
Stacey, is there anything else you would like to share with our friend um, as we get ready to close out?
Just that if you're experiencing pain, it doesn't have to be a life sentence. And sometimes it feels like that, especially if you have so many other things in your life going on. Just another thing lumped into the equation. But it doesn't have to be a life sentence. We do want to experience pain to protect us, but ongoing pain that's not allowing us to live our lives to the fullest is something that we can address. So if your listeners out there and they're dealing with this type of a situation, keep looking, keep working to try to find answers, and trust and verify, get information that you hear like from podcasts like this, and then do your own research as well too, and see what really resonates with you to try to find the best situation for your own personal overall health.
That's great. And I know you have a podcast, so why don't you tell us a little bit about yourself, what you do? And I'm sure there's someone out there that wants to contact you and say, help me get rid of my pain.
Absolutely. So my podcast is the same title as my book, The Pain Free Formula. So it's the Pain Free Formula podcast on wherever you listen to podcasts as well. I talk about physical pain. We talk about emotional pain, how to address that. We even had a grief episode as well too. So I really want to expand the conversation around pain. And then in my book, The Pain Free Formula, Solving the Puzzle of Muscle and Joint Pain, that can be found on Amazon. And that's where I break down what conventional medicine right now does for pain, what the medications that are most commonly used, how those really work, and what we need to be aware of. Doesn't mean we'll never use them, but we want to stop and think, do we really need these types of things? Also, how conventional medicine addresses things that does work. And then the part two is, looking at how do we look at our gut health? How do we look at our food sensitivities? What do our hormones have to do with pain? What is stress, and how do we even change our brain to be able to decrease our pain in our system? And then my clinic is, I'm a physical therapist with a nursing degree as well. And my clinic where I practice and my colleagues are as well is New You Health and Wellness, when you can reach me at newyouhealthandwellness.com and reach out to us via email or via the website.
That sounds so easy. And New
Right?
You is like it's spelled like Newyou.
That's correct. Yep.
Okay.
Spelled out.
I didn't know if it was some fancy way.
Just make it simple.
All right. And all that stuff's in the show notes. So that makes it nice. So, Stacey, what's that one thing we should do this week?
I want you to breathe, right? We talked about that at the beginning. I want you to learn how to do that diaphragmatic breathing to just try to get yourself in the present and also create those own good opiates in our own body to allow you to be able to start controlling your pain and decreasing that inflammation.
That's so easy. And is it best like when we're learning to do it like as we're waking up? So we're laying down and as we're going to sleep, or does it matter?
That would be the best times to do it, and even during the day. Like, sometimes I'll tell people who have really busy, crazy jobs like myself, take 5 minutes when everybody goes to the bathroom sometime during the day usually. So when you're in there, just practice that breathing, even during that time where you're, kind of preoccupied with something else, that you can it's a time where you can sit for a minute or two and just get some good breaths in.
I love to stack things. If I'm
Mhm.
doing it and I can put two things at the same time, that's so great. So,
Exactly.
what a great way to just do some breaths while you're hanging out in the restroom
Exactly.
or watching TV or eat. Can you do it while you're eating dinner or maybe in between bites?
Yeah, exactly. That makes you more present while you're eating instead of shoveling everything in like we tend to do, which isn't the greatest thing for our gut health either.
That's true. Oh, Stacey, thank you so much for joining me. I love the topic. I love knowing that my body has everything it needs if I feed it correctly to push through all the things I need it to do. Our bodies are magical. And so being able to tap into that magic is great. So thank you for sharing that with us today.
Well, it's an absolute pleasure to be here. Thank you, Laura Jane, for having me.
You are welcome. And friend, thank you for joining. I am not a licensed medical or mental professional, just here for entertainment. Want to help you make it down your path with no pain and as smooth as possible. And stay tuned for the next episode.
Are you tired of waking up exhausted? You are not alone. If you're looking to take your life back, let's start with the simple step of adjusting your self-talk. Stay tuned for the next episode with your host, Lara Jane. Remember to follow the show so you don't miss the next simple step that you can use to feel more confident. And please leave an honest review.